Hi everyone, we're back again. This is Dr. GERARD CUOMO. I'm working continuously on Ken's case, and as I come up with more ideas for this case, I'll try to get them to you as quickly as I can. This case is now ready to go to Atlantis. I want to just show you a little bit about this articulator. This is a combi articulator. This is the custom guide table that was made and accepted by Ken. This is going to dictate exactly where we are as far as transferring the byte registration and the byte path of his byte, which is group function, to the implant bridge. So here's our mock-up, triad mock-up ready for Atlantis. I made a silicone index for them as well. I'm trying to give them as much information as I can. So I'm going to separate these two, and you notice right away this is the outline. They're going to use this again to verify where the abutments are as far as occlusion and spotting in the design of the abutment. So let's take this piece off. I can just slide that without breaking it. There we go. So there is your silicone index. That'll slide on and off now on this lower model. You can see where I've been adjusting the occlusion of the upper, and I did polish it, so now the marks are somewhat gone. But to give you a final synopsis of occlusion, again, teeth together, adjusted in-centric occlusion. Now we want to go into our path, our guided path, and it's so important that we don't have any interference. His upper right side is going to mainly guide over the cuspid and this first bicuspid. Because of his orthodontic positioning, it's going to be difficult to get both, so we'll keep those two in contact. On the other side, on his left side, we're going with cuspid, and if I could pick up a couple of more areas on the bicuspids, I will in the finish. So right side, first cuspid and bicuspid. Okay, so canine and bicuspid. Might be able to pick something up here on this molar later on. And then in the anterior region, straight protrusive path, we need that a little more even off the two anterior central incisors. And again, I'll be hollowing that out. We just have to make sure there's no interferences in the posterior. All right, but this guide table is very important. A little bit about this guide table. When you make them, this actually comes apart, but you can mix your acrylic together. This is the filastry pin. You place your acrylic, you dough your acrylic in there. We lubricate the pin with Vaseline, and we literally trace our guidance left and right. So you can follow that line, left, patient's left, patient's right, and then in protrusive. And then you can actually go back in and place articulating paper inside of this, or some type of way to register the mark. So you really want to adhere to at least some form of reference, and this is, to me, it's been my guiding light in dentistry, and they work well with this articulator. I'm sure there are others out there that are just as good. This one works for me. And again, don't forget your silicone index, very important, your guide table to get the occlusion right, and then final adjusting on up to Atlantis. Let's get those abutments. Take care. See you next time.